have probably visited a doctor or hospital at some point in your life, but did you know there are actually 10 completely different types of AI tools being used in healthcare right now? Each one built for a completely different purpose. By the end of this video, you will know exactly how AI is changing medicine forever. Let's get into it. AI Medical Diagnosis Tools. AI medical diagnosis tools analyze patients' symptoms, medical history, test results, and imaging scans to assist doctors in identifying diseases and conditions with greater accuracy and speed than traditional diagnostic methods alone. These systems have been trained on millions of patient cases, allowing them to recognize patterns that even experienced physicians might miss, particularly for rare conditions that a doctor may encounter only a handful of times in their entire career. IBM Watson Health and Google's DeepMind have developed AI diagnostic systems that have demonstrated performance matching or exceeding specialist physicians in specific diagnostic tasks, including detecting certain cancers from imaging scans. The technology does not replace doctors, but acts as a powerful second opinion that flags potential diagnoses for physician review, reducing the risk of conditions being missed during initial assessment. AI diagnostic tools are particularly valuable in regions with limited access to specialist physicians, where a primary care doctor, supported by AI, can provide diagnostic insights that would otherwise require referral to a distant specialist. AI Medical Imaging Tools. AI medical imaging tools analyze X-rays, MRI scans, CT scans, and pathology slides to detect abnormalities, measure changes over time, and highlight areas of concern for radiologist review. Detecting cancer, identifying fractures, measuring tumor size, and tracking disease progression in medical images are tasks that require enormous attention to detail and generate significant cognitive fatigue in human radiologists who review hundreds of scans daily. Google's AI system for detecting diabetic retinopathy from eye photographs has demonstrated accuracy matching specialist ophthalmologists, offering the potential to screen millions of patients in areas where ophthalmologists are scarce. The speed advantage of AI imaging is particularly significant. A radiologist might spend 15 minutes carefully reviewing a chest CT scan, while an AI system can analyze the same scan in seconds, flagging urgent findings for immediate attention. AI imaging tools are being integrated into radiology workflows at major hospitals worldwide, not to replace radiologists, but to act as a tireless first reviewer that ensures no finding is overlooked before human expert review. AI drug discovery tools. AI drug discovery tools accelerate the identification and development of new medicines by analyzing vast databases of molecular structures, biological pathways, and clinical trial data to predict which compounds are most likely to be effective treatments for specific diseases. Traditional drug discovery is extraordinarily time-consuming and expensive. Bringing a new drug from initial discovery to market approval typically takes more than a decade and costs billions of dollars, with the vast majority of candidate compounds failing at various stages of development. DeepMind's AlphaFold system achieved a landmark scientific breakthrough by accurately predicting the three-dimensional structure of proteins from their amino acid sequences, a problem that had challenged biologists for 50 years, opening new possibilities for understanding diseases and designing targeted treatments. In silico medicine used AI to identify a novel drug candidate for a lung disease in just 18 months, a process that would typically take 4 to 5 years using conventional methods. The COVID-19 pandemic demonstrated the potential of AI drug discovery when AI systems were used to rapidly screen existing approved drugs for potential effectiveness against the virus, identifying candidates for repurposing in a fraction of the time traditional screening would require. AI patient monitoring tools continuously analyze data from wearable devices, hospital sensors, and electronic health records to track patient condition in real time and alert healthcare providers when a patient's status shows signs of deterioration. In intensive care units, patients are connected to dozens of sensors, generating enormous streams of physiological data that no human team could continuously monitor with full attention. AI monitoring systems process this data continuously, learning each patient's individual baseline and detecting subtle changes that may indicate worsening condition hours before it becomes clinically obvious. Sepsis, a life-threatening immune response to infection, is one of the leading causes of hospital mortality and notoriously difficult to detect early. AI sepsis prediction tools have demonstrated the ability to identify patients at risk of developing sepsis up to 6 hours before clinical signs appear, allowing early intervention that significantly improves survival rates. Remote patient monitoring using AI-connected wearable devices allows healthcare providers to track chronic disease patients continuously between appointments, intervening when data indicates a problem rather than waiting for scheduled visits. The shift from episodic care, treating patients only when they visit a clinic, toward continuous AI-monitored care represents one of the most fundamental transformations in how healthcare is delivered. AI mental health tools. AI mental health tools provide accessible, immediate support for people experiencing mental health challenges, offer early detection of deteriorating mental health in monitored populations, and assist clinicians with assessment and treatment planning. Wobot and Wiza are AI-powered mental health applications that use conversational therapy techniques to help users manage anxiety, depression, and stress between professional appointments, providing support at any hour without the cost barrier of traditional therapy. AI analysis of speech patterns, social media activity, and smartphone usage data has demonstrated potential for detecting early indicators of depression, anxiety, and other mental health conditions before they become severe, enabling earlier intervention. The global shortage of mental health professionals means that millions of people who need support cannot access it. AI mental health tools represent a scalable way to extend the reach of mental health care to populations that traditional systems cannot serve. The ethical considerations around AI and mental health are significant. Questions about privacy, the safety of AI support for people in crisis, and the appropriate boundaries of what AI should and should not handle require careful ongoing attention from developers and regulators. AI surgical assistant tools support surgeons during procedures by providing real-time guidance, analyzing surgical video to identify anatomical structures, tracking instrument movements, and alerting surgeons to potential errors before they occur. The Da Vinci surgical robot system, used in millions of minimally invasive procedures worldwide, incorporates AI capabilities that translate the surgeon's hand movements into precise instrument movements inside the patient's body, filtering out natural hand tremor and scaling movements for greater precision. AI surgical guidance systems can overlay anatomical information onto the surgeon's view in real time, highlighting the precise location of critical structures like nerves and blood vessels that must be avoided, reducing the risk of accidental damage during complex procedures. Post-surgical analysis AI tools review recordings of procedures to identify moments where technique could be improved, providing objective feedback for surgical training and quality improvement that is more consistent and detailed than traditional peer review. The combination of AI guidance and robotic precision is enabling procedures to be performed with smaller incisions, greater accuracy, and faster patient recovery times than traditional open surgery approaches. AI electronic health record tools. AI electronic health record tools help healthcare providers manage the enormous administrative burden associated with documenting patient care, extracting clinically meaningful information from records, and ensuring complete and accurate documentation. Physician burnout has become a significant crisis in healthcare, with studies consistently identifying documentation burden, the hours spent entering data into electronic health record systems, as a major contributing factor to professional dissatisfaction and departure from clinical practice. AI ambient documentation tools listen to doctor-patient conversations during appointments and automatically generate structured clinical notes, capturing the relevant medical information without requiring the physician to type during the consultation. Nuance's Dragon Ambient Experience has been adopted by major healthcare systems to reduce documentation time, with physicians reporting being able to give their full attention to patients during appointments rather than dividing attention between the patient and a computer screen. AI tools that can extract and summarize relevant patient history from large volumes of electronic health record data allow physicians to quickly understand a complex patient's complete medical situation without spending hours reading through years of records. AI personalized medicine tools. AI personalized medicine tools analyze a patient's genetic profile, biomarkers, lifestyle data, and medical history to predict how they will respond to specific treatments and identify the therapies most likely to be effective for their individual biology. The same cancer diagnosis in two different patients can represent biologically distinct diseases requiring completely different treatments. AI genomic analysis tools can identify the molecular characteristics of a tumor that predict which chemotherapy agents or targeted therapies it will respond to. Foundation Medicine has developed comprehensive genomic profiling services powered by AI that analyze tumor DNA to identify actionable genetic alterations that can guide treatment decisions for cancer patients. The vision of truly personalized medicine, where every treatment decision is optimized for the individual patient's unique biology rather than based on population averages, is being progressively realized through AI tools that can process the complexity of individual genetic and biological data at clinical scale. AI Epidemic Prediction Tools. AI Epidemic Prediction tools analyze patterns in public health data, social media activity, travel patterns, climate conditions, and historical outbreak records to forecast where and when infectious disease outbreaks are likely to occur, enabling public health authorities to prepare and respond more effectively. Blue Dot, a Canadian health surveillance company, used AI to analyze airline ticketing data and news reports to identify the emerging COVID-19 outbreak in Wuhan and alert clients 9 days before the World Health Organization issued its first public notice, demonstrating the potential of AI for early warning. AI surveillance systems continuously monitor global data sources for signals of unusual disease activity, unexplained increases in certain medication purchases, clusters of similar symptoms reported in online forums, unusual patterns in emergency department visits that may indicate the early stages of an outbreak. Climate change is creating conditions that expand the geographic range of mosquito-borne diseases like malaria and dengue fever. AI prediction tools model these changing risk landscapes to guide public health intervention and resource allocation. The lessons of the COVID-19 pandemic have accelerated investment in AI epidemic prediction and surveillance infrastructure at both national and international levels, with the goal of detecting and containing future outbreaks before they reach pandemic scale. AI Rehabilitation Tools. AI rehabilitation tools support patients recovering from injuries, surgeries, strokes, and other conditions by providing guided exercise programs, monitoring movement quality, tracking progress, and adapting treatment protocols based on individual patient response. Computer vision AI systems can analyze a patient's movements through a smartphone camera or dedicated sensors, providing real-time feedback on exercise form and technique that was previously only possible with a physical therapist present, allowing effective rehabilitation to continue at home between clinic visits. Stroke rehabilitation AI tools track the recovery of motor function over time with far greater precision than periodic clinical assessments, detecting subtle improvements that may not be apparent during brief appointments and adjusting exercise intensity accordingly. AI-powered virtual reality rehabilitation systems create engaging therapeutic environments where patients perform rehabilitation exercises within game-like scenarios, improving adherence to rehabilitation programs by making the necessary repetitive movements more motivating and enjoyable. The combination of AI monitoring, personalized program adaptation, and remote delivery has the potential to extend the reach and effectiveness of rehabilitation services, helping more patients achieve better recovery outcomes than traditional periodic clinic-based approaches allow. That covers 10 types of AI in healthcare we have for you today. If this video helped you understand something new, make sure you subscribe to ByteSimple right now, because next week we are breaking down 10 kinds of AI photo editing tools. And trust me, you do not want to miss that one. Drop a comment below and tell us which AI healthcare tool surprised you the most. See you in the next one.